Lung cancer is the leading cause of cancer deaths in the United States. The patients who suffer from lung cancer can have a variety of different tumor types, and we do subclassify it into different tumor types. The treatment for lung cancer is complicated and involves many specialties to work together. The 85% of patients who have lung cancer have some exposure to tobacco, whether personal tobacco or secondhand smoke exposure, but 15% of patients have no known risk factors. There is about 15% of patients who have no significant either personal or secondhand smoke exposure. There are other risk factors associated with lung cancer, specifically environmental exposures to asbestos, to radon gas. There's some studies that use of wood-burning fireplaces in poorly ventilated areas it can contribute to lung cancer. There's a possibility of a genetic predisposition to lung cancer, but that luckily only affects about 15% of patients. The great majority of patients, if you dig deep enough, will have some exposures that are carcinogenic that can contribute to the formation of lung cancer. So the challenge with lung cancer is that oftentimes by the time patients present with symptoms, they have developed pretty advanced cancer. The most common symptoms include a cough, shortness of breath, coughing up of blood, weight loss, malaise, overall fatigue. In those patients, oftentimes the cancer has spread to other locations, making the treatment more complicated. Early stage lung cancers are often found by accident or through screening, and those patients have a higher chance of having an early stage or curable cancer. Oftentimes patients who present with a cough, shortness of breath, or wheezing, the doctors may want to test them for asthma, emphysema, bronchitis. So those are much more common disease processes, and it's appropriate to rule those out first. But the symptoms can mimic those of lung cancer. So if treatments for those benign conditions don't improve, then the doctor should dig deeper. Again, my name is Michaela Straznicka, and I'm a proud member of the BASS Medical Group.